Hi Daniel.
Hi.
Hi, thanks for coming down today. Can you please introduce yourself?
Yeah, my name's Daniel. I'm 40 years of age. I've been living here in Singapore now for 4 years. I'm married. I have one daughter, a young daughter, and there's another baby on the way. So
Okay.
very soon.
Great. So you're here to see us for your low back problem.
Yes.
Can you please probably describe to us what has happened?
Okay. Well, 20 years ago, I injured my back. I was involved in a house fire. Jumped from a window. I had a fracture of my L1 to L5 in the lumbar region. Had no problems for a number of years, lived quite a fit, healthy life in my 20s. I was quite active and circuit trained. And then 4 years ago, 2011, I had some surgery where I had a microdiscectomy and decompression at L4, L5. And I would say it took about 6 to 9 months recovery from that. Just managing pain through medication. I was working, and then from that period on, I had no real issues. I became a bit lazy. I wasn't exercising as much, but I wasn't taking any pain relief, and everything was okay. I was able to work every day. Then in July this year, I was involved in a road traffic accident. In considerable amounts of pain. I had to go to accident emergency, have an X-ray on my back, so it was feeling quite bad. I was discharged that evening, painkillers, and then I went to see some physio to have a look because I was suffering quite badly in pain, and was advised, I think you should probably go and see a specialist. So I saw an orthopaedic surgeon. Was given MRI scans, X-rays, putting my spine in different positions, and the advice I received from the surgeon was that to have a lumbar fusion at L4, L5 and L4, L3. So effectively that would be 3 vertebrae together, I believe. That was quite a big decision to make, and I read up on it and looked at success rates, and I was a little bit scared of the prospect of that, so I sought a second opinion. So I saw a second surgeon. Their advice was not to proceed with the fusion because they felt I was too young to do that. And during this period, I had to take various painkillers. And I was hearing some quite strange, not strange, but scary is probably the word. Some of the recommendations and the impact that the injury on my condition would have on my life. So, okay, don't do the fusion for now. Give your body time to recover from the accident, which they estimated would be 3 to 6 months. But then you must never lift over 5 kilos again. And with a baby on the way, that was quite a sad thought. You will not be able to jump anymore. You may be able to start running again, but only on a treadmill, not outdoors. One surgeon said to me, if I was you, I would be depressed. And it was quite a scary prospect, particularly with my previous history as well.
You've really gone through a surgery, but what they recommended is actually something more invasive, right?
Yeah, and I knew the effects of having a major back surgery before as well. The after effect, it's very painful. There was a relatively long recovery, but I also saw from what I read up that the fusion was even more a major plus. I don't know how to quite describe it. And of course, if you have a fusion, you can't undo it.
Okay. Yeah. So you decided to seek another opinion?
Well, I wasn't satisfied with my the way my pain was being managed, because it wasn't just lower back pain and sciatic pain in my legs, which I was familiar with because I had surgery before. But I was having a really bad pain in kind of like my upper back, which was unusual because it was like a new symptom. I'd never experienced this before. And I wasn't satisfied with the pain management, although I was happy with the advice I was given. Kind of told me what I wanted to hear because I was quite frightened of the prospect of the fusion. So I saw a pain management specialist who I'd seen a number of years ago when I was recovering from the first surgery, and I remember that although I only saw this doctor once, he seemed to give quite sound advice, and I was confident. So I decided I'd go back to that person again. And I was getting my pain was being managed through different medication. I still haven't been able to work. It's a desk job. I sit a lot during the day. And I was given some more advice again, and I was hearing things such as be careful about what you do, the way you sit, the way you bend. So I was getting some good advice for pain management, but I was still hearing things of what I couldn't do with my back, what I should refrain from, what I should be wary of. Then I think it was the end of October, I had a minor procedure to help, because I tried to return to work, but I couldn't do it, the pain was too great. A nucleoplasty and a frequency ablation, which was less extreme than having a fusion, so kind of risk-reward. We were uncertain about the reward, but the risk seemed quite low, so I thought I would go ahead with that. I think there was some slight improvement, but I still, returning to work, I still couldn't feel I was ready yet. There was still complaining of a lot of pain, but the specialist I was seeing there was saying, well, this is muscular now. This is pain that I'm going to refer you to a physical therapist to help rebuild your strength, because surgery may not fix the issues that you have, and you're still not in a situation where you can return to work. So I think we should give you some physical therapy, which is when I was first referred to see you at the Soul Clinic.
So before seeing us, what were your thoughts you had before you came for physiotherapy?
Throughout this was 4 months since the accident, and I've had a range of thoughts: fear, depression. I was worried about how can I look after my family. I'm the breadwinner. But before I came to see you, even though there was still an element of fear, because I still hadn't returned to work, and I was still conscious of what I was doing and how I was sitting, how I was standing, what I was lifting. I did feel quite positive in the sense because I was confident in my doctor. I've been getting sound advice and good treatment up until this point. So even though I was still a bit nervous of how I was leading my life and what will the end game be, I started to think that, I think the physical therapy route may help.
Yeah. I remember when you came to see me on the first time, you were complaining of a lot of burning behind your back when you were sitting, and you were having a desk bound job.
Yes.
Yeah. So how has it been since you are doing some physical therapy?
Well, I've returned to work. I think this is the first time today that you've seen me wearing shirt and trousers.
Yeah, that's right.
And I feel a little bit of discomfort at work, but it's something I can handle and I can manage. I can stand up and walk around a little bit if I've been sitting for too long. It's just my body reminding me that sitting for too long is unhealthy anyway. My colleagues were surprised when I first went back to work and returned, because it was 5 months. Some had told me that I looked trimmer. I still think I need to do more exercise, lose more weight, but they could see that I looked healthier. And I just felt great mentally because I'd actually got back to work again. As well as physically, I could feel improvements.
Let's say we go back to the first session where we had physical therapy. How would you describe the interview process before we started doing the treatment?
Very good, because I think we must have spent 30 or 45 minutes just talking about the history, and it was a really thorough kind of. I felt it was a good diagnosis, and you were listening. And I think the first take home though was when you put me on the treadmill and you filmed me from behind, and I could see the gait for the first time and how I was walking. I was hunched forward, I was leaning to one side unconsciously, and you were even saying to me, you're leaning to the right, but my body was telling me and my brain was telling me, no I'm not, I'm walking straight. And then you showed me the video. I was like, wow, I didn't realise that I was in such a poor condition.
and the fact that we changed the way you walk, and yet
Yeah.
it didn't increase your pain.
Initially, to begin with, no. And over time, you know, I think what I was doing 3 kilometers an hour for 5 minutes or something, walking in the correct way.
Yep.
And my wife's saying, you're arched up, just go straight. And I'm saying, I am straight. And she's saying, no, you're not, you're arched up. And I'm arguing with her, saying, no, I'm straight.
Yep.
And then she straightens me, and I feel like I'm in a completely different position
Yep.
than what I am. So she takes a photograph and says, look. Right, and then gradually, now I'm able to walk straight to start with.
Yep.
And I can walk faster and quite briskly. Almost a jog now. And when I'm at home on the treadmill, people will actually see me jogging for once.
Yep.
Instead of the bald guy who comes in and just walks.
We're doing really well.
For a much longer period. And during that time, to begin with, there was maybe a little bit of a flash where I felt a bit sore or a little bit of pain, but I knew that it was actually, I was benefiting from this, because then if I walked the same speed for the same length of time the following day, I didn't feel anything, and then I'd go faster. Okay, maybe feel a bit sore, but then faster again. I could feel a steady progression, and I just had confidence that I was getting good advice.
I think it was also good that you actually tried to ask me questions throughout the progression of exercises.
Yeah.
You were unsure whether you need to wear a back brace when you were exercising,
Yeah.
and you emailed me quickly.
Yeah.
So it was great that you were asking me such questions.
Yeah.
Because most people would be fearful and they'll be stopping whenever they feel a new increase in symptoms. For you, you understood what's happening,
Yeah.
you knew it would come on, but you still increased slowly as advised.
Yeah, and because I was quite fit in my 20s, I used to circuit train 3 or 4 times a week. I could differentiate between a little bit of pain or muscle tiredness the day after you've had a workout and the chronic pain that I was feeling before. They are two very different types of pain. They vary in intensity. It's just a different type of pain. It's difficult for me to explain, but unless you feel it, I guess. But I was able to do that.
Also, from the first session, I felt that when I was assessing you, the way you were moving, you were very cautious of not hurting yourself. When I moved your leg, you were so cautious of me letting go of your leg immediately.
Yeah.
So you're controlling yourself very, very cautiously.
I was tensing up as well when you were like extending my leg back and assessing the kind of movement in my hips. I was tensing up, and that was a subconscious fear of what's this guy going to do.
Yeah.
But I very quickly got confidence in the treatment, and I knew I was in good hands because, as I described before, when I was having medical advice, it was don't do this, don't do this. You start telling me what I could do. Don't be afraid of this movement. Yes, you can do that. Yes, you will be fit again and stronger, and you will be able to carry your child, and you will be able to do ultimately some more high intensity exercising like I did before. And it was like a flick of a switch from being don't do this, don't do this, don't do this, to you can do this, and this will help. That was the biggest difference.
So Daniel, in your context, how important is core stabilization exercises compared to the hip stretches, the hip strengthening, the quadricep strengthening you were prescribed with?
Yeah, well, before I came to see you, and you hear a lot about when you've got a back problem, improve your core stability. So I even looked up some videos on YouTube on how I can do that and try to, help with the stomach and the lower back. And then I came here, and it was almost like that was thrown out the window. And all the exercises were around buttocks and the hips and squats, and it's much more beneficial than what I found.
When we assessed you, you had a really tight hip muscle.
Yeah.
You had really weak quadriceps muscles. You're not using your left leg at all.
Yeah.
You're leaning all to the right.
Correct.
And that resulted in a tight and weak muscle. So in your case, when we prescribe exercises, it's more specific to what your problem is.
Yeah.
So most of it was more focused on your lower limbs rather than your core stability.
Which was quite a surprise, really. But I could feel benefit to doing it straight away.
Yep.
I could just feel that little bit. I was feeling just that little bit stronger and that little bit fitter, week on week. And I think it must be now about 6 or 7 weeks since I first came to saw you, and I can walk up quite a long flight of steps and feel okay. Whereas before, I think my thigh muscles would probably burn after the third or fourth step, and I'd get to the top, or my legs would be like jelly. Where now I can climb with little problem.
You mentioned that you were carrying groceries and you saw the escalator was there, and you decided to climb up the escalators.
Yeah, before I would have tried to find the elevator and take the easy option, and I got to the bottom of the escalators. They were, relatively quite far up in height, and I kind of thought of you. I thought, no, Mr. Leanne would want me to walk up these steps, so I went up them and quite easily and felt good for doing it. So there's this little switch now in my mind when I do encounter situations like that where I don't take the easy, lazy route anymore. When I was trying to assess with myself with my pain specialist, am I ready for work? I went in on a weekend and thought, right, I kind of did an experiment on myself where I thought, let's see if I can sit at my desk for a few hours in a working day. I would get up and walk around from time to time, not just try and sit for 3 or 4 hours solid, because that would be impossible. And the pain was just so bad that day when I got home, which prompted me to go for the procedure. And looking back now, I think I was actually sat on my tailbone because the muscles all in my buttocks and around my area had just deteriorated so much. I was sat on my tailbone. Now, following all of the exercises and the squats and the different varieties, I actually feel I'm sat on buttocks again.
4, 5, 6, 7.
Great. And there's a strength there that wasn't before, and it's not the core stability or what I would think of as core stability, such as the ab muscles. What's improving my condition, what I feel, is the strengthening and the exercise that I'm doing around the hips and the thighs.
And you're also doing
with some exercises for the core.
Yeah, and you're doing some aerobic exercises too.
Yeah.
So other than just strengthening, you're also doing the treadmill stuff.
Yeah. And that feels good as well. It just feels good. I'm enjoying it. I'm actually enjoying it. I feel good after an exercise. I feel good after a workout. It's almost like I'm doing my circuit training again, but not to the same intensity. But I get the same feeling afterwards. So it's fun.
So what would be the advice that you would like to give people who are suffering from persistent back pain or chronic back pain?
I think the biggest message, and this is something I'm going to take forward for the rest of my life, because I may experience back pain again before, is that it's not the end of the world. And the worst thing you can do is fall into the trap of becoming lazy and fearful and not moving in a particular way because you're frightened it might hurt. I've actually forgotten to take my painkillers sometimes because I felt good. Not that I haven't done it deliberately. I've got to a time where I thought, oh, I haven't taken my painkillers. Whereas before, I'd be anxious that I'd need them, and maybe it's okay, 30 minutes later I'll be able to take them again. And when I first went back to work, I felt a little bit sore, but what I did is I came home and I went straight to the gym and I walked on the treadmill for 20 minutes. And that was my medicine, so to speak.
What advice do you have from your pain specialist with regards to your medication?
Not to be too hasty and just stop. I will see my specialist on Wednesday, and I think it's time to start discussions where I return to work for a couple of weeks to start gradually reducing the medication. So don't be rash, and sometimes I've been a little bit overexcited because I'm feeling beneficial to just stop, but that would be not the right thing to do, and just to phase out over time.
Do you think it's important to have some form of painkillers in terms of your whole rehabilitation?
Yes, because if I wasn't taking the painkillers, I don't think I'd have been able to exercise as well as I have. Because okay, I can exercise a bit through a little bit of pain or a bit of soreness here, but without the painkillers, I don't feel I would be able to have done the exercises as I have. So it's helped as part of like a package to help with the rehabilitation. Ultimately, I want to stop, and I feel confident now that that will be the case. 3 months ago, I wasn't confident about being able to go back to work, or I might have to undergo the major surgery. So to be in the place I am now, where I'm back at work and I can manage my medication reduction over time and see an end goal and be active again and be able to pick up my daughter and play with my daughter and be a father and not a grandfather. Yeah, it's going to be great if I'm a grandfather one day, but not now. I'm only 40. I'm not ready for that.
Yeah.
And I can everything's more positive now, and it's not as frightened as I was.
So with some kind of pain medications, you do have some side effects like dryness of mouth, feeling giddy, or sometimes feeling sleepy.
Yeah.
So what are your side effects, and how do you deal with them?
I can get dry mouth. The obvious one there is to rehydrate, drink water, which I do plenty of, particularly when exercising. And then one of the other side effects is, for sure, drowsiness. And it would be easy to fall back into the same trap again with the drowsiness, to just relax and sit in front of the TV and do nothing, but make the effort to do a bit of exercise. And actually, doing more aerobic exercise, it just helps generally anyway with your drowsy or feeling tired.
Okay, that's great. So let's look at the goal that we set when we started, or right before we started physiotherapy. I mentioned that you should be thinking of going back to work after about 2 to 3 months' time.
Yeah.
Yep. So how long ago have you started going back to work?
I think 7 to 8 weeks. So ahead of what we originally discussed, I think, which is great. I'm still working. I'm working reduced hours at the moment because I've had some really supportive bosses, I have to say. They probably won't see this video, but my bosses have been great. They've been really patient, lots of empathy, and very sensible of my return to work and to just build the strength up. But it's way ahead of what we first discussed 2 or 3 months. Yeah.
It's actually very important to have very good employers so that they can integrate you back into work early, but with reduced hours, so you do not go right straight back full time, and that sometimes can flare things up quite badly.
Definitely.
So it's great that you can still continue some form of rehabilitation during the time when you're still going back to work, and increasing your hours gradually.
When I spoke to my boss and I thanked him for being so supportive, he's looked at it in a common, sensible kind of way, and he said, "I need you to come back strong and fit again. Don't rush back, because," and I've said this as well, it would be the worst thing to do would be to rush back and then only just kind of think, I can't do this, I'm still not fit enough, and then just go back and lose time ultimately. So it kind of goes against the idea, really. So I'm quite lucky that I've got that support.
So what do you think of the few months or years that you have after today? What are your plans?
My plans? Become a father again in a few weeks. Not worry about pain if I experience it. Get back to working full time very quickly. And I'm going to continue to exercise. I'll continue to stay fit, because that will help prevent my pain and any kind of flare-ups I might get. And ultimately, call it a midlife crisis, I don't know. but I want to get back to the same level of fitness I was in my 20s.
That's probably going to actually prevent a lot of problems coming
Yeah,
in the future.
yes, definitely, for sure. And I think that's going to be, it's like a preventative measure as well. And, you know, it's just good for general health anyway. So I should be doing it.
Okay, good. Congratulations on your new child in future.
Thank you very much.
Okay, thanks.